Good morning, everybody. Welcome to the NHS Forest conference, and I'm very privileged to be the keynote speaker for today. My name is Alexis Percival. I'm the Environmental and Sustainability Manager with Yorkshire Ambulance Service. And I'd like to give you a bit of a rundown as to what biodiversity means to the NHS and how we can work together to increase the amount that we need on our estate. How do we go about making a biodiverse NHS? Our world needs climate action on all fronts, everything, everywhere, all at once. Antonio Guterres, the Secretary General of the United Nations, stated this a few months ago, and it's true. Biodiversity is a key part of this, and we need to work out how we can make our climate action and our biodiversity interlink together. The sorrow that a nation has felt over the past few weeks from the loss of the Sycamore Gap sycamore tree has exhibited our link to a solitary sycamore tree. But essentially, we are in the process at the moment of losing ecology across the whole of the world, not just in our own backyard. This 1,000-year-old tree was lost last week through a farmer just accidentally knocking it down. It stood in the same spot since the Battle of Hastings. We need to really, really seriously think about how we change our connectivity with biodiversity. In fact, we're in a stage at the moment that biodiversity is even more critical than it's ever been. As the climate strengths exhibit, we're in the process of superheating our world. But also, we're in the process of losing en masse our farmland birds, with a 55% loss in the past 40 years. And also we're losing moths like nobody's business as well, with an 86% decline. Even the blue infrastructure is losing all of our freshwater biodiversity. And since 1970, we've lost 83% of our biodiversity within freshwater. Global biodiversity across the planet is in steep decline, and we need to work out how we can link our climate action with a biodiversity action as well. The two are interlinked, and essentially we need to work out the direction that we go and how, as the NHS, we can help, and the health system, we can change this direction. In fact, the biodiversity crisis is at an all-time low. We've lost a devastating amount of wildlife, with 17% plant species in my patch alone since 1970s have gone extinct. 1 in 4 of our plant species have declined since 2000. 7% of our large moths have declined since 2000 as well. And we've got a massive decline in the number of breeding birds that have distributed across the UK. In fact, we've lost nearly 20% of our biodiversity, and we are in desperate need of trying to work out how we can save it. So, how is biodiversity connected to the NHS? It's connected in so many different ways. We have a potential to kind of reap huge amounts of health benefits from this. When we look at this diagram here, you can see that a biodiverse NHS has engagement. We're looking at what we can do to interlink our patients with lots of different activities, and the benefits come out of that as mental health. We've got green space, we've got air quality benefits as well. But biodiversity also leads to things like food growing and looking at what we can do to increase our biodiversity through insect species. And we can build in our biodiversity into our buildings, into our sites, into our green spaces. So we can reap the benefits from this. But in reality, how can we do that, and why do we need to do that? The Lawton report back in 2010 had a major impact in the way that we perceive wildlife species and wildlife corridors, and the benefit of that, of how we can interlink with that. It stated that we need bigger, more connected wildlife spaces across the whole of the UK. England's Tree Action Plan also kind of highlights what we need to do there, but there, stuck in the middle, green surroundings for hospitals and schools. The benefit of trees in our landscape is key to this. Also, the recently released UK HACC report says that we need to promote biodiversity and we need to increase our food-based diets as part of this. So as we move forwards, we can see how much of an impact we can have. But when we look at the state of nature, we are in dire need of changing the way we operate. The State of Nature report was issued a few weeks ago, and it says we need to improve the way we conserve our species. We need to look at our nature-friendly farming. We need to look at ecosystem restoration and coordinate our response. And we are a key part of that within the health system. The Environment Act also is the big stick that we all need to be aware of. So as we kind of stroll around, we need to work out how we can change our biodiversity by mandating it. So the Environment Act actually says that we as public authorities have a responsibility to conserve and enhance biodiversity, agree on policies and specific objectives, and we also need to work on who complies with this as well. So government departments and public bodies, local authorities and statutory undertakers are all obligated to do this. And the timeframes? We all need to have a plan in place by the 1st of January. The NHS as a whole has an obligation to look at biodiversity duty, and we need to work out how we do this. But also, COP15, which is the COP to look at biodiversity, says we need to restore 30% of our terrestrial and marine environments by 2030. How are we going to do this? How can we do this in our estate, and how can we reap the rewards and the benefit from this? So, how can we increase biodiversity? I throw down the green gauntlets, the gardening gloves to all of you. How can you do it? How can you do it in your estate? How can you do it on your NHS sites, your GP surgeries, your dental surgeries? Nobody can do that. We don't have the green spaces. What are we talking about? So, first way of starting this process is to look at mapping. And some of our green estate have already started to look at what we can do to map out our green estate across the whole of the health system. By understanding what we have, we can then understand our biodiversity that we have already got and what we can augment. So when you look at a hospital site, there's a lot of grey. Can we change what we plant, where we plant, our tree cover? Can we rip up some of those car parks? But also, where can we put things? Could we put some therapy gardens in there? Could we put green, cool spaces? Can we map out and change the way we look at our hospitals, our systems for health? The answer is yes. A key and quite astounding project that happened down at Great Ormond Street was the rooftop garden, which was highlighted in DIY SOS several years ago. It took this little tiny space on top of a hospital and looked to change it into a green, tranquil space where parents could go and sit and reflect on things, have consultations and get to escape from the hospital corridors. So we can change things from within. We can also build in biodiversity. We can, when we're physically building buildings, we can retrofit things as well. So bee bricks, swift boxes, bird boxes can all go up. We can also look at having bat roofs, and the impact is huge on everybody's in sight. You can see biodiversity literally outside your window. We can also put in other things that we can engage with our staff, engage with our local community, engage with local scout groups, bug hotels, bee hotels, lots of different places and different types of visual aspects that we can change that can inspire the other generations to look at what we can do. We can put in ponds, and ponds have always been a challenge within health systems, but it is noted that green infrastructure has lots and lots of benefits, but blue infrastructure also does. Little tiny ponds like this one, through to big spaces. The one on the right hand side I installed last week, and there are lots of benefits from that, from people just sitting and watching the wildlife that zooms around it. We can also invest in green walls that kind of have a benefit of taking air quality to a much higher level, but also they improve the look of buildings, and they also can protect and insulate buildings in a different way. Wildflower meadows on our sites, we can go from little tiny grass verges to really large parts of fields And the benefits from this as well is a mental health impact for our staff, for our patients. It gets people outside, gets them walking on a lunchtime. Across the estates, there are so many inspirational spaces that have been planted up with wildflower meadows. In fact, this is a site at Pinderfield Hospital where they counted up all the plant species that they had, and within the space of an hour they'd counted over 42 species of wildflowers just in their field next to their site. We also have the opportunity to put back in biodiversity by installing hedgerows and lots of different places that birds and wildlife species can go and hide in. But also, by changing the way we look at things, by having a no-mow May, a no-mow summer, we've discovered species that we never knew were there. In the middle was the pyramidal orchid, which has not been found outside of a hospital in many, many years. I discovered a group of different bee orchids located on 3 of my sites by just not having mowing regimes in place. So we've got opportunities to help and rescue and preserve different species, but also we can help the species that are on the brink of extinction. This is a fairly innocuous looking plant, the tansy, and in York we are looking to kind of reinstate the tansy beetle, which is only found in York. 24,000 individuals have been counted, which is a really small population of beetle that can be wiped out in a flooding incident. But this little tiny iridescent beetle is a symbol of what we can do on our NHS sites and help to preserve what we have, but also play a part in our community in preserving our different species. Through NHS Forest, there have been thousands of trees that have been planted. This is my site in York, where we've planted over 2,500 trees. And they are all now, 3 years on, sprouting above the grass and above the cowslips. And it's an inspiration to walk around such a beautiful site. Across other areas, in Welsh Ambulance Service and various different NHS sites, people have been planting trees, a great engagement tool. And when you start to look at what has happened with the NHS Forest programme, you can see how much of an impact it's had. This NHS Forest plantation was planted in 2011, and 11 years later, these huge trees are there for staff to go and have a wander around and the public to enjoy as well. But also you can cram into a really small space, a tiny forest, and many, many species and different plants can help that, and the benefits for our staff are huge. We've got opportunities to preserve and grow our own food as well. So orchards have been popping up all over the place, and we've got a wonderful array of different orchards that staff have been planting. And at Welsh Ambulance Service, they've put in an orchard. We've put one at our AOC as well, and our Emergency Operations Centre, with a wide realm of different heritage apples for staff to grow and to pick as well. And this beautiful hospital orchard shows how much of an impact it can have with providing apples and pears and plums into our own hospital system as well. We've also got an opportunity for really small space growing with forest gardens. Look at what's below the ground, looking at things like chickpeas up to a herb layer, a shrub layer, a low tree layer, and then going into larger trees like sweet chestnut and other things. We can have compact space growing that can provide into our health system. But the key part of this is how we engage people with nature. When we start to look at Sycamore Gap, there's somebody who was very, very disconnected from nature and didn't understand how important that biodiversity, a lone single tree in the middle of a very sparse landscape, had on so many people and how many people's lives that could touch. But in reality, when we take biodiversity to people, we need them to engage and we need them to be part of that journey. So getting them to plant trees, working with the community, working with children, adults, mental health patients really, really can help provide that engagement. But also we've got sites that we can utilise to continue with the staff engagement, continue with community engagement. This wonderful site, the Health Meadows down at Uni Hospital in Llandoch, is an inspiration where they have meadows and orchards, and they have dead hedging courses, and they engage with their staff, their mental health patients, to kind of move them in a different direction. It's a complete inspiration, but it's about taking everybody with you. Many different hospitals are also looking at what they can do to engage their staff and their outpatients with growing food and connecting to nature. These spaces are really fantastic to link people in to what is on their doorstep as well. But for all of us, we need those mental health spaces and how we can connect into those inspirational green spaces going forwards. We've got health walks within our estate. We've got spaces where staff can relax and patients can go, and we're reaping those benefits. We're reaping what we can do to link our staff, our patients, to the spaces around our health system. But also, do we know what we've got? This amazing site at University Hospital Glenfield Hospital in Leicester is an inspiration. The Secret Garden was like this back in 2016, and now they've inspired so many people to get outside, to engage with nature, and they use it as part of their rehabilitation for staff and for patients. They've installed art installations, and people use it to kind of have their daily walks as well. So we need to engage, and we need to link in our nature that's on our doorstep, because essentially the climate and the ecological crisis is a health crisis, and the two are intrinsically linked. We need to link people to nature. As we move forward, we need to go from the sparse mown lawns and move forwards to green spaces with wildlife, with insects, with trees, with plants, with stuff that's soil biota that is healthy, because we are literally destroying our nature if we don't, and we're destroying ourselves, because biodiversity is life after all. So I put a pledge out there to you and throw the green gauntlets down. How can we make our own healthcare biodiversity pledge? We need to restore, we need to regenerate, and we need to preserve. We need to plant trees, plant biodiversity, and grow life. We also need to create our own food security in a really, really unstable future. So we need to have these things within our health system on our doorsteps. But also there are health benefits that come from how we connect people into nature. We can increase our biodiversity by 30% by 2030, and we need to do this, and we need to do it now.
Good morning, everyone, and a very warm welcome to the NHS Forest Conference 2023. My name is Sarah Jordan, and I'm the Green Space for Health Director at the Centre for Sustainable Healthcare. And we're delighted to welcome you all here this morning to talk about the trees and woodlands on the NHS estate. We've got a lineup of some fantastic speakers. Thank you to Alexis Percival for the keynote speech that we've just heard. If you've just logged on and missed out on that, don't worry, you can find a link to that. It's just been shared in the chat and it's been emailed out to everyone as well, so you can go and watch that back. This is the programme for today. So we're starting off with a first session this morning about trees and woodlands on the NHS estate as a healthcare asset. Our second session, after a short break, will be about planning for tree planting and woodland creation on the NHS estate. We're then going to have some time for networking, which will be on a separate Zoom link, but we will explain how that's going to work when we get there. We'll have a short break for lunch, and then our final session will be about using the NHS Green Estate for health and wellbeing. We'll then have our NHS Forest Awards to hear some more really inspiring stories about how people have been using healthcare sites in the NHS estate for biodiversity and community engagement and all sorts of really other really exciting things as well. I've got a few bits of housekeeping just to talk through. So we're using Zoom today. It's a webinar format, so you won't be able to turn your video or your microphone on, but we would love for you to engage and get involved. So please do use the chat box, and I'll explain how to use that and the Q&A box in just a minute. To let you know that all the presentations will be recorded and made available on our website. So if you do miss out on any bits, or you want to go back and listen to a talk again, you will be able to do that after the event. As I mentioned, there'll be a networking opportunity at 1 o'clock where you will be able to turn on your videos and chat to people. But as I say, we'll explain exactly how that's going to work when we get there. To explain on the next slide how to use the chat and the Q&A boxes. So you can use the chat box, it's down on the right hand side. If you just make sure that it above the chat box it says to everyone, that will make sure you are speaking to all of the participants and everyone who's here at the conference today. And actually it would be great if everyone could start off by just introducing themselves, maybe say who you are, where you've come from, and perhaps what's brought you to the conference today. It would be really great just to hear from you and get to know who else is here at the conference. So do go ahead and do that now if you'd like to. If you have any questions for any of the panelists during the Q&A sections or during their presentations, you can click on the Q&A box and type in your question, and the chairs will be able to see that, and they'll be able to direct those questions to the panelists. So any chat or questions for general people, put that in the chat box. But any questions for the panelists, make sure you use the Q&A function, otherwise your question might be missed. You can also upvote other people's questions. So if anyone asks a really great question that you want to hear answered, you can just thumbs that up, and it will be more likely to be seen by the chairs. And a final note, you can turn on your closed captions by clicking on the CC Show Captions button, and that will help you to, that essentially generates automatic subtitles, so you'll be able to follow along if that is easier for you. So without further ado, I think that's everything from me. Really hope you enjoy the day today. And I am going to hand over to our first chair, Warren Percival from RSK, for the first session. Over to you, Warren.
That's great. Thanks, Sarah. And hopefully everyone can hear me okay. Just a quick thumbs up from Sarah if you can, that would be great. So yeah, good morning. Just want to reiterate a couple of points that Sarah's made there. Very much a big warm welcome to everyone to this conference, the 2023 NHS Forest Conference. We do have a really interesting series of presentations, an opportunity for open discussion across the day, looking at where trees and woodlands sit within the NHS estate. What's their value in terms of from a personal and a planetary health perspective? If we look across the estates and the delegates that are online here, from green plans, looking at NHS Forest support across estates, to government policy on things like biodiversity net gain and this kind of yo-yo policy that we've seen of late. I think we're potentially preaching to the converted to some degree here with the conference delegates, but I think really looking at that intrinsic value of green spaces, what they mean for health, and how do we balance that against other commitments that we have and pressures that we've got across the NHS, in particular when we think about estates backlog, issues around funding, issues around winter bed pressures that are coming down the track. This particular session that we're going to be covering off next is really going to be looking at a diverse and knowledgeable panel of speakers addressing those issues within the healthcare system, specifically on where trees and woodlands are seen within the context of the NHS estate. And we're going to pose a question as to, how do these sit within a healthcare asset? Should they be seen as a healthcare asset, both in terms of planetary health and helping to enhance healthcare outcomes? I'm Warren Percival. I'm the Healthcare Director at RSK Group. We are a corporate sponsor of the Centre for Sustainable Healthcare and the NHS Forest, and a keen proponent of everything that the team are doing. So it's really great to see so many people registered and online today. Personally, I am a fellow of IEMA and a chartered environmentalist, and currently the current chair of the UK Environmental Law Association, UKLA. So I'd like to think that I walk the talk to some degree, but my role here today really is to try and keep everyone to time, including myself. So we'll be starting shortly, and to try and field questions. So just reiterating that point that Sarah's made, it's really important that if you have any questions during the course of the session, that you raise those in the Q&A section. It's fairly easy to deal with. If we can answer some of those questions online, we will. Otherwise, we'll be posing those to the presenters as we go through the sessions itself. So whilst we allow Dr. James Levine to get himself ready to be spotlighted, perhaps just a brief introduction for James. So James is a Senior Research Fellow at Birmingham University. In this topic, he's going to cover what do we know about the role of trees that they have to play in reducing exposure to air pollution. So James, if you wouldn't mind taking the lead now.
Thank you very much, Warren. That's super. You just share my screen. So I'm really grateful for this opportunity today to talk with you about what do we know about the role that trees have to play in reducing exposure to air pollution. And although I'm going to be focusing in on roadside environments for reasons that we'll come to, I'm going to start broader than that. We've been leading a programme of work, I've had a programme of work that we've dubbed Green Infrastructure for Roadside Air Quality at the University of Birmingham over the last 5 years. And I'd like to acknowledge all those that have contributed to this. So I have colleagues here at the University of Birmingham, but also more recent collaborators at Trees for Cities and the UK Centre for Ecology and Hydrology. And my thanks particularly to Rob Mackenzie, who's not just been involved academically in this work, but he's director of the Birmingham Institute of Forest Research, to which I'm affiliated. So a little bit of scene setting to kick off. I think if we asked people what they thought of when we talk about air quality or air pollution, we'd get a range of answers. So for the purposes of this talk, I'm not going to focus on carbon dioxide, CO2, though it be obviously incredibly important alongside other potent greenhouse gases like methane with regards to climate change. But instead, my focus is going to be on those primary pollutants, including fine particulate matter, PM2.5, and nitrogen dioxide, NO2, that are of direct harm to human health upon inhalation. And by the same token, I'm therefore not going to focus on the very valuable role that trees and other forms of vegetation have to play in terms of photosynthesis, taking in, sequestering CO2 from the atmosphere and releasing oxygen. We're going to focus on the role or roles that vegetation have to play in reducing our exposure to these pollutants. I want to get up front. The very best way to improve air quality is to reduce emissions of pollutants at source. We should be doing this first, foremost, to the fullest extent that we can. But we can also reduce people's exposure to what is still emitted. And that will lead to further health benefits or further reduce the health impacts of air pollution. So means of mitigating, reducing our exposure to what's emitted should be considered as secondary to reducing emissions. But it's also valuable, it's complementary. And it's in this capacity that vegetation has several roles to play. But those roles vary considerably with what scale of vegetation we're looking at. So I'm going to start with taking a sort of national view. And when you add up all the vegetation across the UK, then a study by the UK Centre for Ecology and Hydrology in partnership with the Office for National Statistics in 2018 estimated that the deposition of pollutants to leaf surfaces, that's the removal of those pollutants from the air, saves the UK approximately £1 billion a year in health costs avoided. That's not just the cost of healthcare provision, but also loss of productivity. Now, in absolute terms, a saving of £1 billion per year is a great deal and is absolutely to be valued. But as with all big numbers, we have to put them in context. And in the same year, the Royal College of Physicians estimated that the total bill that we face as a nation as a result of exposure to air pollution is of the order of £23 billion per year. Now, these two studies employ different methodologies, so we're not directly comparing like with like, but I hope that one puts the other in context. It's really valuable that vegetation removes a fraction of some air pollutants, but it's likely removing a relatively small fraction of those pollutants. If we move on to sort of city or block scale, and what I'm showing here is a picture, a coloured picture, if you will, of the concentrations of nitrogen dioxide across Greater London. We're going to look at a different role that vegetation has to play. So the colour depicts the concentration of NO2, and we can pick out some broad features. Firstly, that the concentration of NO2 is greatest in the centre of London, where we've got the yellow squares, and it gradually drops off as we move towards more rural areas. But you can see other features too. You can make out the M25 running around London with elevated concentrations of NO2. You can see a green patch that's still more elevated above Heathrow Airport. And you can see patches such as this, where we've got a region of blue of slightly lower concentrations. If we home in on that one, we find that it corresponds to Richmond Park. We have to be careful about the attribution of changes in air quality to the roles vegetation are playing. So in this case, the explanation doesn't lie in the removal of pollution by deposition to leaf surfaces, at least not primarily. Road transport is the main source of outdoor air pollution in urban areas. And the concentrations of pollutants emitted from vehicles are most concentrated close to the vehicles and then drop off with increasing distance. Now, supposing we sort of look through a cross-section of a city where we've not got green space, but where we've just got buildings, and between those buildings, we've got roads carrying vehicles, and those vehicles emit pollutants. With increasing distance, including vertically, those emissions are mixing with somewhat cleaner surrounding air. So the concentrations are dropping off as they're diluted. If we look instead at a cross-section through a city where we've got a large green space, then yes, we'll still have emissions from vehicles to either side, and yes, to some extent, they will encroach on that green space. But if we were looking down from above, we'd see lower concentrations. What we're seeing is the absence of vehicular sources of air pollution. Now, they're still incredibly valuable for air quality, because they're providing that space for pollution to disperse, and in so doing, sanctuaries of cleaner air for recreation and active travel. And if we're really creative and ambitious with our inclusion of green space and linking of green spaces, then perhaps we can also tempt some people out of their cars and onto their bikes, or combined active travel with public transport. And we can make these spaces more attractive, more enticing through the inclusion of trees, not just grasslands. And indeed, trees can help stimulate further mixing between the relatively polluted air at ground level and somewhat cleaner air aloft by creating rougher surfaces with which winds interact. But primarily, these green spaces in urban areas are not removing the pollution, but they're providing spaces for pollution to disperse. And we're going to continue on the theme of dispersion as we move to roadside environments. So these are environments where we encounter some of the highest pollutant concentrations. Vehicles are the single largest source of UK outdoor air pollution. And roadside environments are ones in which we actually spend a not inconsiderable amount of time walking on the pavement just a few feet from vehicles. So we're going to home in on that as we look at our work around green infrastructure for roadside air quality, or GI for RAQ. And in 2018, the Air Quality Expert Group reported to DEFRA and the devolved authorities on the impacts of vegetation on urban air pollution. And one of the conclusions that they reached was that when we introduce vegetation at the roadside between vehicles and people, and the wind's blowing from one to the other, that vegetation is not primarily removing the pollution or filtering the air. But what it is doing is diverting a fraction of the polluted airflow around people in the immediate wake of the vegetation. And that's really valuable because it can reduce those people's exposure to proximate sources of pollution by up to 50%. We have to be a little bit careful that reducing exposure to these local sources by 50% doesn't equate to a 50% reduction in concentrations, because in these regions, we're still exposed to some of that pollution from nearby vehicles. We're also exposed to pollution from all the other vehicles on surrounding roads that's now well mixed in the air and we can't shelter people from. So realistically, we're looking at up to about 10% reductions in annual mean pollutant concentrations in the immediate wake of the vegetation. But that's really worthwhile as a secondary complement to emission reductions. Now, it gets a little bit complicated, and there's a follow-on review by Baddock et al. In 2020, which highlights the complexity of the impacts of vegetation in urban environments. We're going to get into a little bit of that here. The story will get easier in a moment. But rarely in the urban environment can we simply say the wind's blowing from A to B, from vehicles to people, because buildings get in the way and do some strange things. So when the wind blows across a line of buildings, here pictured running into and out of the plane of the screen, it will create a recirculation region, the wake of those buildings, where actually the direction of airflow at ground level is reversed relative to that aloft. Now, if the street's wide enough, then airflow will be restored beyond that to airflow that's parallel with that aloft. But any air entrained down into the street has also got to escape. And as it encounters other buildings on the far side, or vehicles or street furniture en route, with each meeting with an obstacle will create further vortices. And suddenly it becomes really quite difficult, at least just intuitively, to say whether vegetation in one location or another, or of one type or another, will be of benefit for local air quality. And still harder to put numbers to how beneficial or of how much disbenefit it would be to plant there. Now, my focus is going to be, of course, that picture grows still more complicated when we factor in changes in wind conditions aloft. The wind doesn't always blow in one direction. It's constantly changing in direction and strength. Now, I'm going to be focusing in on lower vegetation barriers at the roadside, with less emphasis on trees specifically, but more emphasis on hedges and such like. But I expect that some of you will be interested in the role that trees play. And I think we've heard some mixed messages around that, so I want to try to offer some clarity that scattered trees will have little impact on air quality for good or ill, but deliver lots of other benefits, so are really valuable. Where we need to put in a little bit more thought is when introducing so many trees that we create dense tree canopies within streets. On streets that are free of traffic, these canopies can be beneficial. They can help reduce the import of polluted air from above down to the level at which we breathe it in. But on roads carrying traffic, those dense canopies would risk partially trapping emissions from vehicles, accumulating to higher concentrations and worsening air quality. So with that, green infrastructure for roadside air quality, looking at hedges and so forth at the roadside. We've developed free open source software, freely accessible at www.gi4raq.ac.uk, with which you can estimate the impact of if we plant this here, how do we think it will change the annual mean concentrations of nitrogen dioxide and fine particulate matter in different regions of the street. Now, you've got to put in really quite a lot of information about the location of the street of interest to you, to pick up the right climatology of wind conditions, distribution of wind conditions aloft, to pick up the right background concentrations of air pollutants with which emissions mix, the strength of emissions on the road of interest to you, the geometry of the street and orientation street with which the wind conditions interact. It's quite a lot of information required, but we provide links to public sources of this information. This software, though, offers, for instance, inbuilt records of authorship. Users can table proposals of what to plant where and exchange analyses with each other, logging who's proposed what and what the estimated impacts would be. But we've been taking a further step with the software to produce a complementary version put to different use. So the software I've just shown you is intended to help answer the question, what might the local air quality impacts be if we were to plant this here? But people were coming back to us, combined authorities, community forests, asking the question, well, if our remit is to look at planting across the whole of this borough or the whole of this city region, where would planting of this sort be expected to deliver greatest benefits? We've got a blank page, where should we start? And to that end, over the last 12 months with Trees for Cities and the UK Centre for Ecology and Hydrology, I've been integrating the GI4RAQ code into digital mapping software or geographic information system software. We're starting by developing, again, a free open source demonstrator based on the London Borough of Tower Hamlets that analyses thousands of sites along a supplied road network. In this case, the Transport for London managed, owned roads within that London borough, the major roads within that London borough. And then automatically, the software will determine all the local conditions at every site needed to drive the air quality code, and ultimately illustrate in the bright green those locations where we think planting would be reliably beneficial, would deliver net improvements in public health as a result of its impacts on local air quality. And this could be applied to a borough, a city region, or it could be applied to an NHS estate. With that, just a couple of preliminary findings. These are hot off the press, but firstly, it's good to see that we do identify locations where we think that planting would deliver meaningful benefits, reductions of the order of 10% in annual mean concentrations of nitrogen dioxide and fine particulate matter at the roadside, whilst not leading to significant disbenefits anywhere else within the street. But a word of caution that we also find locations where the introduction of planting, which is not illustrated, because in this case we find it to be of disbenefit, we think would be of disbenefit across the whole of the street, even on the far side of the vegetation from the road. So the impacts are not always intuitive once we factor in variability in wind conditions and off changes in wind direction, their interactions with local urban form, and so forth. So some take-home messages. The best way to improve air quality is to reduce emissions of pollutants at source. But trees have valuable secondary but valuable roles to play in then reducing our exposure to what is emitted. And at those three different scales, nationally, vegetation removes a small but valuable fraction of air pollutants. At city or block scale, green space allows pollution to disperse, and trees within those green spaces can help stimulate vertical mixing and enhance that dispersion, spreading out dilution of pollution. And thirdly, at street scale, planting in the right places can reduce exposure to vehicular pollution. But we've got to plant strategically, by which I mean selectively, to deliver those benefits. We want to deliver reliable benefits and avoid unintended disbenefits. So thank you. With that, just a pointer to some of the decision support resources that we've produced for green infrastructure for roadside air quality. So mentioned, this demonstrator will be coming online, open source, freely accessible within the next few months to explore broader regions. But when looking at one site at a time of interest, the GI for RAQ platform at www.gi4raq.ac.uk is already in the public domain, freely accessible. If you're interested in using this software, the best place to start is looking at the press release. I'm going to put up 3 links here. They're all shortened bit.ly links, starting with GI for RAQ press. And from that press release, you can link to the peer-reviewed paper documenting the methodology behind the software. That paper was picked up recently in the UK Parliamentary Office of Science and Technology's policy briefing note on urban outdoor air quality. And if you're looking for a policy briefing note on the role of vegetation in street scale, then we wrote one as a contribution to Policy Solutions, the Clean Air Challenge, and that's available at GI for RAQ Policy, page 9, Clean Infrastructure for Clean Air and One Health. So with that, thank you very much for this chance to talk about what do we know about the role trees have to play in reducing exposure to air pollution. I welcome your questions later or offline. Please do reach out to me at my email address or connect with me via LinkedIn. Thank you, and thank you to the organisers. Many thanks.
That's great. Thanks, James. And I'm sure if we were all in person, there'd be a huge roar of applause now and people asking for more. I mean, some truly excellent research there. And I'm sure there'll be lots of questions that come up as a result of that as we get towards the end of the session. Just a note on that, there's a lot of chat at the moment in the chat function, which is great. Any questions that you do have, though, if you could please raise those in the question and answer section. That way we can get straight to that and ask those of our panelists. So we're about to pass over to Dr. David Armson from the Mersey Forest. And I think, you know, anyone would think that we've actually put some thought behind the panel here. What a fantastic segue into the work that David's been doing with the Mersey Forest. And David's session is going to be particularly looking at how trees can have a positive impact on heat and cooling within a localized area. So Dr. David Armson, over to you.
Thank you. Good morning, everybody. As already said by other speakers, thank you for the opportunity of speaking. I'm just going to share my slides. Hopefully you should be able to see those now. So I am Dave Armson. I'm from the Mersey Forest, and I've put up our front cover of what we call our Mersey plan. It's the Liverpool landscape. I've done that for 2 reasons. One, it's always good to mention your employer when they've given you a couple of hours off. But the second one being that picture kind of shows a whole host of landscapes in which trees can be used and would be beneficial. And I would say that trees, obviously as a tree planter trying to get trees in the ground, I would absolutely say there's not an environment I've met yet that trees can't be beneficial. But actually today I'm here to talk about trees, specifically heat, which goes back to my PhD some 13 years ago, 14 years ago, that only now really is starting to be really noticed by those policymakers and really starting to be really focused upon with great intensity. So it's heat and climate cooling. It's a bit of a mislead, actually. Climate cooling, I would say less heating, but we'll get to that as we go through. So I want to talk quite broad first, and then bring it down to trees specifically. I'll whiz through that first section in the name of time saving, but we'll have possibly heard this term urban heat island effect, where, and I'm sure some of you may have heard it, the centre of London can be hotter than its surrounding rural area due to the way in which urban areas are built and created. This means that the centre of it could be somewhere in the region of London is sometimes 8 degrees warmer than that rural edge. And that's largely due to higher surface temperatures in the urban environment, greater heat storage in the urban environment, urban canyons, and a reduction in green space. And this is a very oversimplified graph on the right-hand side. And you'll see as we reach the centre, it gets a higher temperature. And on that graph, it's saying about 4 degrees. As I said, it could be much higher, and actually in hotter countries, higher yet still. But as you move across to the right, you come to the park, and there's this little dip, and it's called the Park Cool Island, where the temperature drops very localized to that area. And that's due to the vegetation. Because if we have a look at those areas in a little bit more detail, with urbanization, we've got lots of built surfaces, concrete, bricks, all these kind of surfaces. And what they do, they take the radiation from the sun and they don't reflect it as effectively as maybe vegetation does. So they actually start to begin to store heat. They actually store that heat to a much higher level than vegetation could possibly do. And then they also, when they've absorbed that heat, then they can't get rid of it as effectively because they've got these high urban canyons that trap that heat in. They reduce the view to the sky. So they can't get rid of its long wave radiation in as effectively as a park may be able to do. And it reduces latent heat loss. That evaporative cooling that we talk about quite a lot. There's not a lot of water in concrete or bricks or in the urban environment. So you effectively lose that ability to use that heat energy to evaporate that water as well. And contrast that across to your parkland or your green spaces, I'll start to refer them to. You get an increased reflection of that shortwave radiation coming from the sun, bouncing it back out, so it's not had the opportunity to be stored. Equally, some of that shortwave radiation coming is being used. We mentioned photosynthesis before, that the way trees produce their food. It's actually using that shortwave radiation and actually taking that out of that energy equation because it's using it for its own means. It doesn't store heat in any way near as effectively as a concrete block. As you know, your storage heaters on your wall basically filled with a big block of something that you heat up, and it stores that heat. When you switch it off, it still keeps radiating that heat. Vegetation doesn't have as much capacity to do that. And they're just more open spaces, very much similar to the talk we just had about pollution, that open space. Same with heat, it allows it to escape, it allows it to get away. And of course, all the time, trees are using water, and some of that water is escaping through their leaves, and that is evaporating, offering that cooling. So there's a real contrast between the two environments and what's being offered. It's not just vegetation that does that, though. Well, we're kind of looking at these built environments and going, how can we change them? How can we make them better? Because we have these headlines of metropolis meltdown and various other titles that come with it. It's not just trees and vegetation. I want to cover this really quickly. You could paint those buildings a more reflective colour, get it bouncing off. You could redesign your entire city to encourage airflow in the right direction, or reduce the use of air conditioning units, change our lifestyle entirely. You could redesign them again to reduce that canyon effect. You could create massive open swathed spaces. You could increase water and fountains and ponds in your cities. That is huge infrastructure change that's quite difficult, very hard to do, and in reality, not much of a possibility of doing that in a lot of cities that just, have been there for years and are not going to just be able to change like that. So while they're good, the reality is it's not going to happen. So trying to bring that down a little bit more now to why this matters to us as people. Well, not only is it hotter, but certainly in heat effects, when we get in our heat waves, we start to get these other headlines of so many excess deaths, as they're called, per year. And that's due to heat stress as a person. We get these especially with the elderly, especially those who are vulnerable with vulnerable health conditions. Exposure to this heat for a prolonged period of time causes issues in terms of health. And it's just exacerbated by the urban environment. It makes it worse because we get in the daytime these high peaks, and then at night, when we should be losing all that heat and radiating it away from the earth effectively, in your rural areas to the left and right of this graph, that temperature drops really low at night. We get rid of that heat. However, in the urban centres, where we've stored all this heat in these buildings and in concrete surfaces and built surfaces, it's continually radiated at night. Still trying to get rid of it in the same way, but it's trapped in those canyons. It's just releasing that heat. So your next day is starting from a higher start point as well, but also you're not losing that heat. So that heat exposure continues for a longer period of time. A week, 2 weeks of heat waves, that is going to be causing you much more heat stress on your body. So let's bring that to human beings then, us peoples as we are. We have an energy balance ourselves that controls our heat, as we all know. And we've all heard of evaporative cooling, sweating. Sweating's really effective. If we all know, speaking to medical professions in the large, it takes the heat out of our body to evaporate that water that we produce, taking the heat with it. If we raise humidity, if we raise the air temperature, that becomes less effective. Exactly what's going on in your urban environments. We have conductive and convective cooling. Conductive, if I touch something, if it's cold, you feel the heat leaving you, you feel cooler. Convective cooling is, again, that air movement around you. Moving air around you helps you cool down. It makes it more efficient to strip that heat away from you. However, in the urban environment, we can create very still environments. Also, that air temperature is higher. So again, these become less and less effective. But beyond any shadow of doubt, the most important when it comes to heat and human comfort is radiant heat balance, the radiation exchange. So when we're talking about that radiant exchange, we know if we wear a lighter t-shirt when it's hot, rather than a darker t-shirt, it's reflecting that radiation away, that shortwave incoming radiation, you stay cooler. Equally, if we have a radiator on the wall, bonfire at night's even a better example. That bonfire at night, when you go to it, you feel warmer when you stood by it. That's got nothing to do with that fire warming the air temperature, because it doesn't. It's a tiny little fire in a globe. It's making very little difference to the air temperature. That's all radiant heat exchange, that burning material, sending out that energy, you receiving it as heat energy, and it's actually within you, warming you up. So that radiant heat exchange is key to human comfort. So let's look at that with a little bit more detail. If we take our average tree, I'm going to start focusing on trees now, as I'm roughly halfway through, and that's what I'm supposed to be talking about. Vegetation and trees both show that Park Island cool effect. However, I would argue that trees have a kind of trick up the sleeve that make them a lot better for this. And it's one we all know, but when we start getting into it, makes it a little bit more obvious. So we have all our incoming radiation from the sun, shortwave radiation. It hits, and across the bottom, you've got two green squares, which is what the one on the left is vegetation in sunlight. The one next to that is vegetation in shade, and then with tarmac in shade and tarmac in full sun. And this is about those surfaces storing heat. So the shortwave radiation comes in, some of that's absorbed by the tree, some of it's reflected by the tree, and some of it is transferred down through the canopy. If we look at that when it hits the ground, those two surfaces in contrast, tarmac absorbs a lot of that radiation. It reflects very little of it, whereas the green on the left shows that vegetation does reflect a good deal of that. However, in the shade, both of those are going to reflect less of that or going to have less shortwave radiation reaching them. So although the reflection values differ massively, the actual absorbed radiation across the bottom changes dramatically in the shade. So I want to just kind of make a note of the temperature on the right. That absorbed radiation of the tarmac is near on 100%. We are losing some of it through reflection. Whereas on the left, where the green is, it's reflecting a lot of that away. So less is absorbed. Compare that to the two in the middle, the green and the black in the middle. Far less is absorbed. That means that far less heat is stored in the shade of trees, because just not as much radiation is reaching it. when we compare, and that's just as a matter of your vegetation reflecting far more heat and very little being transferred below the canopy. So when we compare those, the red line being concrete in sun, the blue lines being concrete in shade, so this was in the shade of a tree, you can see a massive difference between the two just by shading alone. When we look at that then, the green being the grass in the sun and the yellow being the grass in the shade, while vegetation performs much better than those built surfaces, the shade is still providing an advantage to reducing the heat stored. So less heat stored, less to be radiated at night. Moving that on, that same example, but putting people in that environment now, we've still got the same incoming radiation. We've still got the same impact by the tree in reflecting and absorbing and transferring that. However, when we compare these to the people stood underneath them, a person in sun is obviously going to absorb far more of that shortwave radiation, but a person in shade is going to absorb far less of it. We all know sitting in a tree shade makes you cooler, but combining those two effects together, we can see now how trees are going to affect the air temperature and the radiation balance over the period of that 24 hours. It is important to say, and I would say this is why I think trees trump vegetation, that reflected radiation that grass will do, that will reflect, as we saw from the previous slide, that's below your feet. It has to reflect somewhere. So if you're stood on the grass, some of that is being passed on to you as a person. So this is where trees, that green space is now above your head, is reflecting that shortwave radiation away before it ever gets to you. We can measure that through these fancy things called globe thermometers. It's effectively a plastic sphere with a temperature in the middle of it, painted grey or a grey colour, to kind of give a representation of what the radiant balance that a human being is going to receive. And that sounds very posh. I made my ping pong balls painted grey with a temperature in front of them. Science can be rough and ready, but it's still effective. If we compare that again using this graph, the two top lines, the green line is actually a globe thermometer above grass in sun, and the one in the red is a globe thermometer above concrete in sun. And as I'm saying, that reflected radiation value from the grass can actually increase that radiant balance. Luckily, in the UK, we quite often have it with clouds, but nonetheless, it's an important point to say not all green spaces are the same. However, if I have a look at it in shade, doesn't matter whether you're over concrete or over grass, there's a massive saving in temperature and that radiant balance to make you much more comfortable. So a well-designed green space offering shade, offering the overall benefits of green spaces cooling the air, can dramatically alter the environment and the way we experience that environment in terms of heat. So these are some thermal images I took, looking at just what trees are going to do and how they affect that. So you can see here, or try and make out, you maybe squint your eyes a little bit, is we have a tree in the middle of the picture. You can just about make out the trunk there. A car on the left in full sun, a car in the right in the shade of that tree. And there's almost 20 degrees difference between how those cars are experiencing that heat. That's why we choose to park our cars in the shade. Makes it much, much more comfortable. Different picture, just looking at the effect under shade. We've got a red path at the bottom of this picture, storing all that heat, heating that surface temperature up. Compare it to under the tree, much, much cooler again. So building those environments. It works at different scales, so we can see that stored radiation on the right-hand side of this picture, or stored heat on the right-hand side of this picture with our tree, holds much less heat in the canopy. The one on the left is the little green dot I'm looking to kind of notice. This is all over a built tarmac area. That little green dot is just from a very tiny tree, shading it out and making a real difference to how much is being stored. And throughout the day, that will sweep across. Finally, people in those environments as well. So on the left-hand side, we've got a big brick wall, and the cooler objects in it are the people. The important thing to note is that red brick wall is radiating heat out, and it is heating those people. So while they're cooler, they are getting warmer. On the right-hand side, we see the contrast of the person in shade. The person is the hotter object in that shade. Therefore, they're getting rid of their heat across into that environment. So experiencing that cooling effect because they've been designed well and are sat in that shade as well. So some take-home messages, and I've got a few little pictures to kind of demonstrate how we can use trees well after this. Green spaces do help at the larger scale. They do reduce the heat, and it's air temperature. But air temperature, going back to our human comfort, is not the key one that we're looking at. It's not the one that's going to define how we feel in that environment the most. Yes, it helps with our convective cooling and it helps with our evaporative cooling, but the major factor is our radiant balance. So yes, green space help lower the air temperature, and that's a good thing. But overall, just those green spaces aren't going to be enough. That reduction in air temperature, we need to look at how those vegetation spaces affect a person's radiant balance and how they feel more comfortable. And trees reflect that radiance before it ever reaches us. They provide shade that we can go and get refuge from that heat. And overall, they can affect the overall radiant performance of an area. A few really good examples of that are spaces like this. Sorry, it's a bit of a pixelated image. When I transferred it across, it got a little bit messed up. But you can see we've got vast amounts of trees in a space here. The key thing is, in urban environments, look how little space they actually take up on the ground, and yet provide all the shading that's going to keep that area much, much cooler and a much more pleasant place to be in. Those car parks, those dreaded black spaces that you can really feel the heat in, bring green spaces into them, but make that green space above your head, raise the canopy up. Green spaces where people enjoy, and put trees in them. Find, not only are they cooling, the evaporative cooling effect, affecting the radiant effect as well. And then a well-placed tree is by far key. You can see trees on the left and on the right of the road, and this is next to the final slide. But those trees are shading the building, which keeps the people inside that building cooler as well, because those surfaces are not heating up and not storing that heat. And also, as the sun moves around, they then begin to shade the road that then keeps cooler as well. Or go whole hog and bring the green spaces right into your building. This is a real building. This is, a project going on that shows we can put trees in the most unusual places. Final point, and I'll shut up after this, is there is funding available through DEFRA. Go and have a look for a community forest. If there's one in your area, you can access funding to get trees as well. And we'd love to work with the whole NHS estates team to see how we could do that. So thank you for listening. Thank you for the invite, and hopefully that's been useful to you all.
Thanks, David. Another excellent presentation. And what's been great so far already is just that breadth and depth of science and knowledge from air quality, heating effects, and now a nice segue into how we valorize those green spaces. So I'd like to invite Nick Porter from Forest Research. Before Nick starts, I think what's quite interesting here about how we're threading this together is it's kind of Nick's background, both as an arboriculturalist and working within science and policy at a government level. We're really going to start to see that kind of transition now and how we valorize that green space. So Nick, if you're ready, over to you.
Thanks very much, Warren, and just let me share my screen. Let's bring this up. Can you see that now?
We can see it, Nick. You need to send this to... That's right. Thank you, Nick.
That's fantastic. Okay, thank you. Yeah, thank you, Warren. And as Warren said, my name is Nick Porter, and I work for Forest Research as part of the Urban Forest Research team. And before I start the talk itself, I just want to start by saying that although I'll be presenting today, a lot of the work that I'll be talking to you about was done by Hannah Walker with the support of Kieran Doig as well. So onto the work itself, we were asked by the Centre of Sustainable Healthcare to look in more detail at the benefits and value that trees across some of the NHS estate provide. And that was to get a better understanding or to feed into potential insights that could be used for their green plans and for their climate change commitments. So that fed into our overall purpose for the study, which was to test the applicability of existing ecosystem service quantification and valuation methods for the NHS estate, to illustrate the insights that can be gained from this process, investigate options for the development of quantification methods for the NHS estate, and to make recommendations for the rollout of the methodology to the wider NHS estate. So when I'm talking about ecosystem services, I'm referring to the direct and indirect contributions trees and woodlands provide for human well-being and quality of life, as has been discussed in the previous presentations. And this picture here just gives a few examples, some of which have already been kind of touched on, such as temperature mitigation, and then things again like carbon storage and sequestration and storm water mitigation. And so initially, we were provided with 4 sites to trial the methodologies. And the first step was to actually quantify the difference between a full woodland canopy cover and then individual trees on the sites. So to talk about the sites in a little bit more detail, on the left-hand side, we've got the Meanwood Leeds site and the Fazakerley Liverpool site, which were 100% canopy, so they were fully wooded sites. Whereas on the right-hand side, we have Royal United Hospitals Bath and Southmead Hospital in Bristol, which are more conventional hospital sites with hospital infrastructure, car parks, hospital buildings, interdispersed with individual trees, or in some cases, small areas of woodland, like can be seen at the north of the Bath site, just up here. And what's important maybe to say at this stage is that although these 2 sites on the left, Leeds and Liverpool, are actually the smallest sites, as can be shown by this table, they actually have the highest hectarage of canopy cover, as opposed to the Bath and Bristol sites, which are much larger sites, but have a lot less trees and therefore less hectarage of tree cover. And that feeds into the values and the benefits that are provided by those trees on both of these, or all of these different sites, which I'll talk about in a little bit more detail in just a few slides' time. So once the sites were mapped, we were able to determine which ecosystem services we were able to quantify. So this table here shows the woodlands down the left-hand side. And then along the top here, we have the 6 different ecosystem services we quantified for this study. So we were able to quantify and value carbon storage, carbon sequestration, air pollution, flood reduction, temperature regulation, and also noise mitigation. And what I'll say about this, what's important is we were able to calculate these ecosystem services for all of the 4 sites, but it's depending on which methodologies we were potentially only able to use the methodologies for certain topographies of trees. So for example, for both temperature and noise mitigation, we could only apply those to woodlands or small groups of trees. So we had to omit individual trees from that calculation or that process. And as a result, that will lead to potential underestimation in the overall value of those ecosystem services. And again, in my concluding slide, I'll talk a little bit more about the consequences of that. So to talk through the valuation process itself in a little bit more detail, as far as was practical, we followed the principles of natural capital accounting, and that's what this flowchart here represents. And although the tools that we used to quantify different ecosystem services differ, the overall steps in the quantification and evaluation process are the same. And to demonstrate this, I'll use the example of carbon sequestration and talk through the flowchart using that as the example. So initially what we needed to do was determine what the asset was. And in all cases, that was always going to be the trees and woodlands on the 4 sites. We then mapped those trees and woodlands, as I just outlined in the previous slides, and that gave us the extent of woodlands and trees outside woodlands on those 4 sites. We then apply what we call unit factors, and unit factors are the amount or the quantity of the ecosystems provided by 1 hectare of trees in a year. So for example, the tons of carbon that's sequestered per hectare by those trees. Once we have the unit factors and the extent of the woodland or trees, we can then multiply those 2 together, and that gives us the physical flow of the service, or the total amount of the ecosystem service in each of the sites. So again, that would be, for example, the tons of carbon sequestered by the trees on the Meanwood site, for example. Once we have that information, we can then apply unit values, and unit values are the value of a single unit of the ecosystem service. So that would be the cost in pounds per tonne of sequestered carbon, which in the UK at the moment is £273, and that's a government figure for the social cost of carbon. And then similarly to this process, we then apply the unit value to the physical flow, and that gives us the total value of each economic value of each ecosystem service at each of the sites. And then the last part of the valuation process is the capital asset value, which is an estimation of the future value of each of the ecosystem services over a 100-year period. The next part of the process, or the bit in relation to the study we did, was looking at the various different tools that are available to carry out this process. And we used 3 different tools. 2 of these tools were iTree software tools, both Canopy and Eco, which model and quantify the physical flow of the ecosystem provided by trees. iTree Eco combines on-site tree survey data with tree biological function models to quantify ecosystem service provision. And FR holds data on previously completed iTree Eco surveys, which we then were able to use to obtain unit factors, which we then applied to the 4 NHS sites. iTree Canopy uses the same model, but bases the calculations on batch runs or values based on average data instead of individual tree surveys. And the other tool or method that we used was natural capital accounts. And unlike iTree Eco or iTree Canopy, it's not a specific software model, but instead each individual ecosystem service has its own methodology based on studies that feed into ONS reports. And we have then used unit factors based on these reports and applied those to the NHS sites. So that's the tools. The next slide I'm going to show you will highlight the physical flows of services provided for each of these tools at each of the 4 sites. So I'll just go on to that slide now. So here we have the tables showing the physical amounts or the stock and annual flows of ecosystem services provided by the 4 at the 4 different sites. And each table shows the values using a different tool. So the top table here is the NCA approach or NCA tool. The middle table is the iTree Canopy tool values, and the bottom table is iTree Eco. And I won't go into detail in all of the values here, but I will just pull out a couple of key points really to kind of highlight, get some of the kind of intricacies of this project across. The first being that, as you can see, the NCA methodology was able to calculate, or we were able to use that and apply that to work out more, to quantify more ecosystem services than iTree Eco. So depending on which tool we use, it depended which ecosystem services we were actually able to value. And the second point, as you may be able to see from the table, is that there is considerable variation between the values depending on which tool you use. So for example, using the NCA approach for carbon stored in the trees on the sites, at Meanwood, that would be 14,000, just over 14,000 tons of stored carbon. Whereas using iTree Canopy, that would be around 3,500. So there's significant difference. And really, the reason behind that is the way that the underlying methodologies are structured. So using the NCA approach, those calculations are based on the carbon stored within the trees, but it's also based on the carbon stored within the soils around the trees as well. Whereas both of the iTree models don't do that. So that results in different valuations. And each of the different ecosystem services that we calculated do have slightly different methodologies depending on which tool is used, and therefore the values will differ. Actually, sorry, I'll just finish. Another thing to kind of raise on that is, leads on to asking what are the pros and the cons of the different tools. For example, we found an advantage of using the NCA method was, as just mentioned, we were able to calculate more ecosystem services. And it also offers consistency with approved national natural capital accounting principles. However, there are disadvantages of the NCA approach, one of these being that it is not location specific. So using air pollution removal as an example, the unit factor is the same for all of the England using the methodology that we did, and therefore 2 areas of woodland of the same size will be calculated to remove the same amount of air pollution regardless of their location. Whereas an advantage of the iTree tools is that they are more location specific, with regional weather and pollution concentration data being factored into the calculations. However, in terms of the iTree disadvantages, one of these would be that the unit factors for the carbon storage and sequestration calculations are based on global tree data and are not specific to the UK. And this could lead to a source of error, or it could be a source of error. So this slide moves us on to the monetary valuation stage of the flowchart, as can be shown by this red square here. And at this point, we have applied the unit values to the amounts or physical flows of each ecosystem service. And the bar graph here shows the economic valuation of each ecosystem service using the NCA approach. And to go through the graph or the chart in a little bit more detail, across all 4 sites, it shows that the economic value of carbon sequestration is the highest across all 4 sites. And that's followed by air pollution, and then temperature regulation. And noise mitigation provides the lowest economic benefit across all of the 4 sites. And what this graph also demonstrates is, as I was talking about in the previous slides with the around the actual sites themselves, both Leeds and Liverpool are smaller sites than Bristol and Bath, but they have a higher tree canopy area. And that's why the benefits are bigger. There is more trees, and therefore, in this instance, they provide more benefit. So going on to the final stage of the flowchart, which is in relation to capital asset values. Ordinarily, following NCA guidance, capital asset values are calculated by discounting flow values over a 100-year period to take account of the potential depreciation of the value of the ecosystem services over time. It wasn't, in this pilot study, it wasn't possible to carry out that more in-depth calculation. So instead, we followed the example set out in Broadmeadow et al.'s 2023 paper on flood mitigation. And instead, here we calculated a per hectare capital asset value to give a rough estimate of the capital asset value over a 100-year period. And here we have the table with the results of those calculations. And again, we have the woodlands across the site, the sites across the top. And then down the side, we have the individual ecosystem services. So to pull out a few of these, for example, Meanwood in Leeds, carbon sequestered over a 100-year period would have a value of around about £563,805. Using flood regulation, Southmead Hospital, over a 100-year period, that would be around £3,823. And then at the bottom here, we have the sum total of each of the ecosystem services for each of the sites, with Meanwood providing the highest overall value at just under £1.5 million over a 100-year period, and Southmead Hospital in Bristol providing the lowest overall value at £292,996 over that 100-year period. So here, I'm going to go into some of the insights gained from the study in relation to the ecosystem services at the various sites that we were looking at. So in relation to carbon storage and sequestration, the NHS contributes between 4 and 5% of national carbon emissions. And at Meanwood, in Leeds, the trees sequester around 140 tonnes of carbon per year, with an annual value of £35,852 using the tree canopy approach. And to put this into some context, the removal of carbon by the woodland at Meanwood is more than the emissions of the Leeds Trust's vehicles, which is around about 97 tonnes per year. Sorry. Although reducing emissions across the NHS would still be a priority, this study demonstrates that trees can be used as an additional measure to help the NHS reach its net zero targets. Going on to air pollution. Air pollution is a cause of health problems, including respiratory conditions, heart disease, strokes, and lung cancer. 29% of British hospitals are located in areas with levels of particulate matter 2.5 exceeding the World Health Organization's recommended limits. Trees at the Bath site remove 0.155 tonnes of pollution each year, with an annual economic value of £3,398 using the NCA approach. And this helps to mitigate the harmful effects of air pollution for patients, staff, and visitors to the site. And this supports the NHS priority action of reducing air pollution on and around hospital sites. Going on to temperature regulation, the UK is experiencing more frequent high temperature events, as just described and has been talked about in the previous talk, leading to effects on health, including dehydration, heat stroke, increased risk of heart attacks, and also strokes. NHS trusts have heatwave plans, and there is a requirement to cool buildings or shut wards at temperatures of 26 degrees or over, and increasing the use of air conditioning on hospital wards to manage this is incompatible with the NHS reaching its net zero targets. Trees, as described, provide cooling through shading and evapotranspiration, and at the Fazer-Curley site, the cooling benefits by trees are worth an estimated £2,999 per year using the NCA approach. And this can contribute to few hours of air conditioning and utility bill savings for people in that local area. Putting on to flood regulation. In the UK, flooding events are forecast to increase as the climate changes. Each of the 4 trial sites in this study are in upstream catchments of communities at risk of flooding. And the Southmead Hospital site in Bristol is subject to high flood risk from surface water. Trees on the site prevent an estimated 534 cubic metres of surface runoff per year, with a value of £947 using the iTree canopy approach, which will help with mitigate against flood risks. And finally, in terms of the ecosystem services we looked at for this study was with noise mitigation. Studies show nighttime noise impacts on hospital patients and staff well-being. Meanwood is estimated to provide a noise mitigation benefit to 21 buildings based on the NCA approach, and this reduces the noise health impacts for the people in these buildings with an annual economic benefit value of £2,109. So this is my final slide. And in conclusion, this study has demonstrated some of the benefits and values provided by trees and woodlands at the 4 NHS sites that we were looking at. But it is important to note that there are some limitations with this quantification and valuation process. So for example, not all ecosystem services provided by trees can be quantified or valued monetarily. And so there will be things that trees are doing that we don't even yet know they're doing and the values that they're providing. So it's not therefore possible to apply methodologies. It's also not possible. There are just some ecosystem services that we don't yet have methodologies that we can apply. So that will lead to an underestimate in the overall benefit that the trees on these 4 sites provide, because we won't obviously be measuring some of those benefits. The methodologies that we use weren't always applicable in all situations. So I mentioned earlier temperature and noise, and in both of the, thank you. In both of those examples, we were able to look at woodlands, as I mentioned, but not individual trees. So again, that could have an impact or underestimate the overall value that the trees on the site provide. And then there are other methodologies that are out there that we weren't able to apply at this kind of earlier stage. So that there are methodologies to look at the benefits provided by, to health by trees and well-being, as well as for biodiversity. And because we haven't included them in this initial study, again, that will lead to an underestimate of the overall benefits that the trees on these sites provide. So in terms of next steps or recommendations going forwards, we would recommend the quantification of trees and woodlands on the wider NHS estate to continue to build our understanding of the benefits that these trees and woodlands provide. Application of the natural capital accounts methodologies to future NHS green estate studies. Incorporating health, wellbeing and biodiversity methodologies where possible into any future analysis or work on the green estate. Further develop methodologies for the estimation of noise and temperature reduction by trees, and UFORG, the team or the Urban Forest Research Group that I work as part of, are doing some work around noise at the moment in that area. And finally, an in-depth capital asset valuation of each of the ecosystem services that were looked at in any future work. So in conclusion from me, it is hoped that the findings of this report will aid stakeholders in directing resources to maximise the benefits trees and woodlands provide across the NHS estate going forwards. Thank you very much. That's my email address down at the bottom there if anyone has any questions after the conference itself. And if you do have any questions, look forward to trying to answer those in the Q&A later on this morning. So thanks for your time. Many thanks.
That's great. Thanks, Nick. I really appreciate all the contributions that our panelists have made so far this morning. What an excellent start. And without further ado, we move into our last panelist for this morning's session, Sarah Jordan, who you will have seen introducing the conference early on today. Sarah's a fairly new, well, my kids will call her a noob, I suppose, but I know not much about that computer game. But having joined literally within a few weeks to CSH, we welcome Sarah to talk about the work that they're doing with the tree equity mapping tool. Sarah's the director of the Green Space for Health programme within the Centre for Sustainable Healthcare, and certainly no stranger to either the environment and the charity sector either, having worked within the sector for a number of years, specifically in the background of environmental psychology. So, Sarah, if I'd ask you to take the stage and close the session for us.
Great, thanks, Warren. I will just share my screen. Great, so hopefully everyone can see that. So yes, as Warren says, I'm still fairly new to this role, but I'm really excited to tell you all about this project that we've been working on in collaboration with the Woodland Trust and American Forest, which is about tree equity, and it's a tree equity score that was originally developed in the US by American Forest, and we've been working in partnership to develop this score for the UK so that we can use it in the UK. And essentially, tree equity, the idea of the tree equity score is to promote equitable access to the benefits of trees. And of course, already this morning, we've been hearing fantastic talks about all of the different benefits that we can get from trees, you know, to name a few, and there are so many more as well. However, there are disparities and inequalities in accessing the benefits that trees offer. And a lot of this is down to where you live and the neighbourhood that you live in. So the tree equity score is essentially a nationwide score that highlights that inequitable access to trees and to the benefits that trees give us. And it measures how well the benefits of trees are reaching communities living in low-income areas, and also people who are disproportionately impacted by climate impacts and other environmental hazards like extreme heat, as we've heard a bit about this morning, and also pollution as well. So I'm going to share a video which I think gives a really helpful kind of overview and explanation of what the tree equity score is. This is from the American version of the scoring, which, as I say, is where it originated. So this is just about a minute and a half. So hopefully this works.
Score that they created.
Tree Equity Score is a free tool for urban areas nationwide so that anyone could get in and get trees to people that need them the most. It's a single measure nationwide that ranges from 0 to 100. It's a combined measure of tree canopy need and social health and climate priority. The lower the score, the greater the need for investment.
So when they gave us the opportunity to use this tree equity score, I needed to understand what tree equity was and also talk to people about it. And it is just unequal distribution of green resources. Some people are experiencing the extreme heat in the summer a lot more. And tree equity really prioritizes bringing those trees and those resources to the areas that need it most.
I think that what's so striking when you look at this scale is just how ubiquitous these kinds of patterns are. You can look anywhere in America and you will see low-income communities, communities of color, have a lack of access to these kinds of natural resources that really improve our quality of life. What's really unique about Tree Equity Score is that it provides an equity-first, data-driven approach to filling gaps in our urban tree canopy.
Great. So hopefully that gave you a bit of an overview of what the score is and how it can be used. And as they said in the video, essentially the score is to help bring trees and bring those benefits from trees to communities that need it the most and that aren't currently accessing it. So why map tree equity? So a Friends of the Earth report found that there is a significant gap in tree numbers between the wealthiest neighbourhoods and those with the highest levels of social deprivation, with the poorest areas most likely to have fewer trees. So image here of the kind of leafy suburbs compared to the more built up urban environment. And it's often the less affluent areas that tend to have a high density of housing and urban infrastructure. So in these sorts of areas, space needs to be made for trees to be planted in those areas, and that can be more expensive in time and resources. So that can often drive this inequitable access to trees. This is, of course, quite relevant for hospitals and healthcare sites in cities and urban areas, because they often have more built up infrastructure, more buildings and concrete to work with, not as much space for trees. But again, as we have seen in some of the earlier presentations, there's definitely ways around that, and ways that we can still be bringing more trees and green spaces into these areas. So how does the tree equity score work? So it works by looking at existing canopy cover, so how many trees, how much tree coverage that already is in that area. It then looks at what the goal for that tree canopy cover would be, and the difference between that. And then it uses a priority index, which looks at 6 climate and socioeconomic characteristics, which help to prioritise where tree planting should take place in order to increase access to those benefits of trees that we've been talking about. So looking into each of those in a bit more detail. So the canopy cover is calculated just for urban areas at the moment. So the project so far has focused on urban areas. It uses Google satellite imagery to help map out that tree coverage. And it's broken down by neighbourhoods, which are used for government data. But reports can be generated for neighbourhoods, local authorities, constituencies and countries to help at all levels of decision making. The tree canopy goal is based on a baseline target of 30%, and that comes from the 330-300 rule that you might be familiar with, which essentially suggests that neighbourhoods should have a 30% tree coverage. That is adjusted then for population density, recognising that, you know, in higher populations, there's going to be less space available. So in high populations, this is adjusted down slightly, and in low populations, that's adjusted higher. And that creates then the goal that we'd be looking for in that area. And then again, it's adjusted for these priority index characteristics that I mentioned. So these 6 variables, which are based on socioeconomic factors and also climate and environment impact. So we've got air quality, age, which of course is proportion of older people and children in comparison to working age adults, health, heat disparity, so where excess heat is generated in certain urban areas, income, and also unemployment. So these are integrated into the tree equity score, and a higher priority index indicates a more at-risk population. So this is a screenshot of the beta version of the tool that we've got. So this is an area in central Sheffield, and it's got a tree equity score of 71. So the aim is to have a score of 100. That means that the level of tree coverage is kind of meeting its goal or is above. So there's a bit of a way to go in this area. So you can see the current canopy is at 12%. Of course, the canopy goal is at 30%, as we've discussed. So there's a gap of 18%, but then this is then adjusted
1 minute
based, thanks Una, on the different factors here. And if you were looking at this as a decision maker, you'd be looking at the areas and thinking, okay, well, the greener areas are those with the higher scores, so we might want to prioritise tree planting in the areas with that are orange, which will have the lower scores. So these are a few ways in which we can be thinking about how we use this in policy. I think particularly about strategies and master plans, which could be city, region, or even countrywide to address tree equity. It could be part of green plans, even particularly for NHS trusts with multiple sites who might be thinking about where they would like to prioritise their tree planting. Of course, in planning and development, in monitoring and data and evaluation, Also in community engagement, maybe getting communities and patients and staff involved in decision making, upskilling people, giving training, and also it can be used as a way of generating investment from external sources. So
that's time.
Great, thanks, Una. Just to finish off then, we're still in the testing phase at the moment, and as part of that, we would love for you to fill out a survey, which Una will share in the chat, and this is just the healthcare sites to help us understand how you could use this score and how useful it will be for you. But that's my time up, so I will hand back to Warren. Thanks.
That's great. Thanks, Sarah. And thanks to all the panelists so far. It's a really, really interesting session. And I don't know about the other delegates, but I've certainly learned a lot, but that's not difficult for me. So there are a number of questions that have been asked during the course of the session. We'll try and answer as many as we can in the 10 minutes or so that we've got before the break. And some of which may be answered live by some of the panelists as well and following the session. James, there's a question that's been raised here by Peter Leighton-Jones. What native trees are best for attenuating air pollution? Can you come back on that?
Yes, okay. See how I organise my thoughts. So at the scale of NHS estates, we're looking at, I think, the sort of city block and street scales where our focus is on providing green spaces where pollution can disperse, in which case the species of tree is not pertinent to that. Or roadside environments in the right locations, providing vegetation barriers, partial barriers to the flow of polluted air, diverting that around people, where the physical characteristics, the density of the foliage, the length of time through the year that it's in leaf, ideally evergreen, providing some obstruction to the flow of polluted air year round is key. There's been a lot of talk around tree species with respect to air pollution that focuses on the deposition of pollutants to those leaf surfaces. And as I've tried to communicate, though valuable, it's actually a small influence. What's more important in providing barriers to the flow of polluted air is that the tree thrives, has dense foliage, and throughout as much of the year as possible. So native would be great for other benefits such as biodiversity, but actually in a changing climate, there might be cases where we want to look at non-native species in order that we're picking a species that will flourish in the future.
I do want to make sure that other panelists have got a chance to maybe jump in on some of these questions, as well as others that are quite specific and directed. So if other panelists want to jump in, by all means do. There is a supplementary question to that, and it links to your answer actually around issues around allergies and tree pollen and certain types of species. And I guess this either a context of whether they might be seen as chemi-adsorbent, or whether in fact actually it's that allergen within the pollen itself that might exacerbate respiratory problems. But any further comments you want to bring in on that one before I ask David a question?
Well, very briefly, so as well as emitting pollen, which of course is concern to some, trees also emit volatile organic compounds that have a deleterious effect on air quality. So there's a balance between deposition of pollutants to trees and emissions of volatile organic compounds. And I'll put a link in the chat to the Urban Tree Air Quality Score that tries to identify the best species for the best balance of removing a small fraction of pollution and not emitting too much of the VOCs. And I think it touches on pollen and allergies too. I'll put a link.
That's great. Thanks for that. And David, there was a question that was raised. We spoke at length there about cooling and the effects that trees have, in particular the canopy and the shading from those. But what about the effects within cold spells or extreme kind of cold temperatures? What effects have you looked at the effect of that and where trees come into that, whether it's got a positive or negative impact?
Yeah, so I mean, in terms of that, less research done that way round. on the cooling effect of it. Being in the UK, we're a fairly temperate climate, so we tend not to focus on that really cold. The answer really, though, is that green spaces in the general scale are going to stay. It's going to be a localized effect, just as they are with the heat or the park cool island. So it's going to be quite localized, stay cooler for a little bit longer. Flip side, that's putting it into the urban environment. One of the advantages to trees particularly is they're adaptive. So one of the things they do in winter, as we all know, trees lose their leaves. So that radiant balance in winter shifts. They've lost that canopy cover. So all of a sudden that radiation can get through the canopy to a far greater extent. So in winter, actually, you're letting the radiation through. You want to get warmer, hopefully. So on buildings as well, if that radiation's getting through, it's still heating those buildings to a lesser extent. Obviously, as we know, it's radiant balance that makes us get colder. So it's still heating those buildings, but then come summer, leaves come back again, and now start to reflect that radiation again. So it's quite adaptive, and that's where, maybe that extra sort of tick on the tree box of a green space again can be really useful.
I'd like to ask a question that I'd actually like the whole panel to answer, and it's a fairly short question, but I think there's a longer answer to this. It's a question posed by Beth. How quickly do we see benefits of newly planted trees, i.e., in terms of saplings versus mature trees? It's a debate we hear a lot about in terms of, certainly from a sequestration perspective, and the negative effects of removing mature trees and their ability to sequester carbon. But from each of your various different disciplines, I think there could be quite an interesting discussion to have here. So would anyone like to kick us off on that one from their particular side of the debate? Or do I just point at someone? Maybe Sarah, would you like to jump in?
I think Nick had his hand up, but
I can't see anybody's hand up.
I am happy to just say, so I probably won't be the best person to answer that question anyway, but I would say that for everyone here, the NHS Forest does have lots and lots of free trees available that we would love to distribute to NHS sites. So do have a look at our website, and I think we're going to share a link in the chat. So
you have to start something. They can't suddenly start as a huge mature tree, can they? They need
exactly.
To have to grow.
So it doesn't answer your question, Warren, but they are, yes, they are great trees. But yeah, I'll hand over to Nick. Maybe he might have a more direct answer.
So what I was going to say, thanks, was I certainly couldn't give a specific time frame to when things become valuable, but to use noise pollution mitigation as an example, when we're looking at that, we're thinking about that mitigation effect, it becomes greater as the tree trunks get wider. It's more important that the diameter of the tree trunks than it is the foliage on the trees in terms of noise mitigation. And so again, like I said, I can't give a specific moment that those trees then become more valuable or provide more benefit. But in terms of making those calculations, I talked in my talk about capital asset values, those values over a 100-year period. If you put a sapling in the ground, it's not going to provide much benefit in terms of noise mitigation for X number of years until those diameters get up to a point where that can happen. So yeah, it's a really important kind of question to ask about when do those values or when do those benefits kick in? And I guess it will depend on the different ecosystem services or benefits that are being looked at, but that would be my kind of take on that question.
David, where do you come in on that? What's your opinion on this?
Yeah, so it's not necessarily, as just said, it's not necessarily an easy question to answer, but one thing that I thought was really quite pertinent, certainly to anyone in estates or looking to get benefits from trees. Obviously, we put in little saplings, 30 centimetres high to maybe 60 centimetres high, but within a very short period of time, I'm talking maybe 7 years, if those trees are really well looked after, if you keep them weed-free around the bottom, they can rocket away and they can really shoot up quite quickly. I'm desperately trying to find a picture as we're speaking on one that I know to show the difference between, because we tend to think we'll turn up, put a big tree in, put the stakes in that we've all seen, cage around it. They're actually under a lot of stress as trees when they go in. They've been whipped out the ground, roots chopped, broken, things like that, and they grow really quite slowly. if we get a tree, the right tree in the right place, I think is one thing I'd love everyone to go. I can see a lot of chat about which tree does what, right tree, right place. Within 7 years, you can be looking up at the canopy. Another 5 or 6 from them, once they've established, can really go really quite fast. So again, I can't put exact figures on it, but the point I'm really trying to make is these trees are going to give quicker benefits the better we look after them. It's the number one things we talk about as a forest. Is getting a tree in the ground is quite easy. Getting it growing well and fast is the real challenge. So the better you look after them, the better those benefits and quicker those benefits are going to be seen.
Having a proper landscape management plan and action in place, that is one thing that we see time and time again, and it's down to lots of different areas of pressure, isn't it, within a trust, whether it's a health board or a trust. But having the funds and the wherewithal to actually plant the trees, great, but you need to make sure that the estates team are aware there's an OPEX requirement to maintain those trees to a certain degree, so that we don't fall foul of being kind of seen as a bit of a white elephant, I suppose. But Sarah, just as we're closing, because we're coming up to time now, there are a few people that have asked around the access to the resource that you provide through NHS Forest and Trees, but I'm assuming following the conference there'll be something sent out to the delegates around how to access that and the resources that are available.
Yeah, absolutely. We'll send links around in the follow-up emails. We'll be sharing some links in the chat throughout the day as well, so do keep an eye on that. But also, you're very welcome to go to our NHS Forest website. As I mentioned, you can order your free trees there. There was a question about our Rangers programme as well, and we've got a contact form on there. So yeah, do get in touch if there's anything that we can help with in particular. But there's loads of resources and evidence and all sorts on our website. And again, we'll put a link in the chat. And yeah, as you say, Warren, we'll be sharing that after the conference as well.
Great. I think we're pretty much on time now. I fear Una's got a virtual shepherd's crook that's about to take me off the stage. So I'm sorry, there will be other questions that people wanted to ask, but we just have run out of time now. But I really would like to thank everyone who's provided their support so far and hand over to Sarah now